Okay, Sydney, do you want to go ahead and get started?
Okay. Good evening, everyone. Thank you all for joining us today for our event, which is called Beyond the Bars, Water Rights and Environmental Justice in New Jersey's Prisons. My name is Sydney Bogan. I will be one of the speakers today, along with Simone Braithwaite. We're excited to have you guys here to discuss the environmental and justice issues that are going on inside of New Jersey's prisons. And we want to thank Councilman Frank Gilmore for allowing us the platform to talk and share a little bit about the impactful work that we've been doing. So each event that we do, we like to do a land acknowledgement. So we like to acknowledge that this event is taking place on the ancestral land of Indigenous people who have lived and cared for this land for generations. We honor their history, culture, and contributions. We recognize the importance of understanding the intersectionality of histories and the ongoing for justice, equality, and community, and we stand in solidarity with Indigenous people and all marginalized communities, and we are grateful for the opportunity to be on this land today.
Yeah, thanks for that, Sydney. Hey y'all, we just wanted to introduce a little bit about the campaign and where our organizations are from. So my name is X, or you can call me Simone, whichever. And I'm the environmental justice organizer for Clean Water Action. I have a background in justice and policy studies, as well as African and African American studies. And just a little bit about Clean Water. We are a national nonprofit, and we were actually formed during the campaign to pass the Clean Water Act. So something that folks use on a daily basis to, advocate for better water standards and just really standardizing our health across, the nation. And Clean Water Action is now and always has been dedicated to protecting water, health, and community through grassroots organizing, advocacy, and policy reform. So our mission is to fight for affordable and safe water and challenge corporate polluters, challenge industry to advocate for stronger environmental policies, and obviously, prioritizing equity and justice. And as an environmental organizer specifically, I work with overburdened communities who are actually disproportionately impacted by pollution to collaborate with them, make sure their voices are lead in the fight for clean air, clean water, and just justice for our communities. So it's nice to see you all here. Have a great turnout.
Thank you, X, for that. And my name is Sydney Bogan. I am currently a graduate research assistant at Kean University. I'm earning my master's in public administration. I'm also the campaign manager for Women Who Never Give Up, and that's why we're all here today. We're going to be talking about our Safe Water, Safe Lives campaign. So Women Who Never Give Up is a grassroots nonprofit that was founded by Gail Muhammad, and our mission is to empower currently and formerly incarcerated people and their loved ones by educating them on the criminal justice system, as well as advocating for their rights and for criminal justice related policies. And so what brought us here today is Councilman Frank Gilmore. We're calling this our Jersey City series. We recently did an event with Council President Waterman and getting the word about environmental injustice issues and advocating for a bill that we are looking to pass. So we reached out to Councilman Gilmore's office to offer us the opportunity to share what we've been seeing with the campaign and the stories that we've been hearing. So we want to thank Councilman Frank Gilmore for, like I said, this platform, and I'm going to leave it to him for some opening remarks.
Councilman, you're muted.
Can you hear me? There we go. Good afternoon, everyone. Thank you, Sydney. Thank you, X. And thank you, ladies, for the work that you do with your organizations. Welcome, everyone, to this afternoon's presentation. This is something that's very near and dear to my heart, advocating for incarcerated and or formerly incarcerated individuals. Because the reality is most of these individuals, in fact, maybe all of these individuals are treated like second tier citizens. So basic necessities in life essentially overlooked when you're dealing with this demographic. Then to add to it, you're more likely to even be subject to harsher treatment if you're a black and brown individual. So I just wanted to, share my platform to come on here to educate, to encourage, to engage, and to be amongst the people who's dealing with this demographic and advocating for this community. You know, we all should have access to clean drinking water. In fact, I will make the argument that the world should have access to clean drinking water and things of that nature. So this right here is something again that's very near and dear to my heart, and I'm grateful to share this platform to be a part of it with you young ladies. And again, thank you for all the extraordinary work that you ladies do.
Thank you,
Thank
Councilman.
you.
No, it's definitely local legislators, local elected officials that, bring these issues to the forefront because this is for our communities, and the communities directly impacted. So we appreciate your support. And we hope to, keep working on this together in Jersey City and beyond. So
Yes, we definitely will. We have no choice. We have to. It's our due diligence to humanity.
yes.
So now we're going to get into what today brings. So first, we're going to talk about what environmental justice is and how that intersects with incarceration. We're going to then talk about some state specifics of New Jersey's incarcerated population. We'll then talk about the long-term exposure and health risks of these environmental hazards. Talk about the Safe Water, Safe Lives campaign and one of the resources that we are collaborating with, which is the Toxic Free Prisons Mapping Tool. And then we will share a little bit into the Bill of Rights that we are looking to pass throughout the state of New Jersey. Lastly, we'll have some closing remarks and some Q&A. We want this to be an interactive presentation, so if you guys have any insights, stories, any questions, please make sure to drop them in the chat, raise your hand. We want this to be as interactive as possible. And to have a space for everyone to learn and then also share their lived experiences if they do have some and if you are comfortable with sharing. So now I will hand it off to X to talk about environmental justice.
Awesome. So let's get into it. So we just wanted to give a baseline definition on what we're trying to advocate for today. Environmental justice is a specific concept, and it's a concept that often has gone overlooked in the past, 20, 30 years when our communities of color have been constantly harmed by environmental issues. So essentially, environmental justice is a social movement, and what we're trying to do is really address the injustices that poor and marginalized communities face when they're located next to hazardous waste, located next to polluters, and the land that they're on really doesn't have the benefits that other communities see. So, for example, and I'll talk about this a little bit more in the next slides, there really is no buffer between Newark, Jersey City, etc., and industry, right? You see it all the time. I live in the ironbound section of Newark where it's literally called Chemical Corridor. And a lot of communities don't live that way. And that's because the allocation of resources, because of how our communities have been disenfranchised, etc. So we actually have a legal definition here in New Jersey and an office to address environmental justice now. These are some quotes from the New Jersey Department of Environmental Protection, or NJDEP, and they have done studies, they have accepted and interpreted the research on these issues and found that one, New Jersey has a problem, right? And New Jersey residents, regardless of where they come from, their income level, their ethnicity, color, national origin, however, have a right to live, work, and recreate in a clean environment. So that's the first basis of what environmental justice is. The second basis in New Jersey is they found research that says that New Jersey's low-income communities have a disproportionately high burden of environmental and public health stressors. So we experience the impacts of pollution, of climate change the hardest, and we experience them first. So the NJDP has made a promise, has made a statement against environmental injustice, and they say that they are seeking to correct the outcomes of environmental degradation in our communities by promoting environmental justice, by uplifting our communities, and really collaborating with us to see the changes that we want in our communities. Next slide, please. So a little bit more about that. I just wanted to give you guys a physical, like visual concept of what this means. Environmental justice isn't something we just talk about. It's something that we live actively. And this is from NJDP. This is called the Environmental Justice Mapping Assessment and Protection Tool, or EJMAP. You can look this up. You can take a look for yourself. And what I do as an environmental justice organizer is try to interpret some of these data points and really find where communities most in need can use resources, are in need of, I guess, the platform to advocate for themselves, because historically they've been, discarded, disadvantaged, and really not taken care of when it comes to environmental stressors. So if you look at New Jersey, right, the first map on the left has where environmental stressors are most prevalent. We see it very concentrated in Newark, Jersey City. Then we go down to Camden, Patterson, etc. And these, not coincidentally, are Black and Brown communities. The blue part, or the darkest blue parts, represent health stressors. So the DEP defines overburdened communities by a specific number of health stressors. They have 25 of them, right? And communities that face the least are in green. The communities that face the most are in dark blue. So I filtered the EJ map out for certain stressors, and these are just a list of stressors that our communities are facing the most. So cancer risk from diesel particulate matter, that means the trucks that are coming by, the trucks that are on the streets. Cancer risk from air toxics, so anything that a company could be putting out in the air. If you see big plumes of smoke, right, we experience that more. Heavy duty truck traffic, sites of known contamination, so they're either contaminating our water or have contaminated our soil, solid waste facilities, because another thing is when these industries come here, they don't leave and not have an impact. So when they come here, they pollute, that land is then no longer safe to use or even live next to. Another problem that these communities are facing are community drinking water violations. So there are a whole bunch of violations within the Jersey City, Newark area, and then those close to Philly. And then potential lead exposure, Newark residents and, just residents where lead exposure has been highlighted, like know this the most. We are experiencing lead pipe issues, impacts of lead. Lead is a neurotoxin. There's no safe level of lead in your body. So the fact is that these communities should not be disproportionately affected by this. Can you go to the next slide, please? And just a snapshot of Newark as an overburdened community. Newark has a lot of public health stressors that just come from where we live, right? Asthma happens to be one of the biggest crimes in the city of Newark because our air pollution is so bad that people die more of asthma than they do from homicides. And our school kids are being affected at high rates as well. So Newark has double the state average and national average for asthma. Newark residents also face the nation's second greatest cancer risk due to diesel. So that truck traffic is increasing the rates of cancer in our communities. And we are also home to one of the largest trash incinerators in the Northeast, which takes trash from all the counties in New York and even parts of New York and other states. And it pollutes the air as well as costs over $9 million in disposal fees. So I just wanted to highlight that as a snapshot, but also the steps that are being taken to address this issue. From the NJDP side, they actually created an environmental justice law. They recognized everything that was going on in Newark, everything that's going on in Jersey City. And I will say a lot of these communities mirror each other, right? I work with groups like Sustainable Jersey City, where they do air monitoring. And there's actually a part of Jersey City that the highway is going to New York through. I think that's the Turnpike. They call that Asthma Alley because the kids there happen to get asthma at higher rates. So New Jersey took a look at all of this, and community advocates came together, demanded they address this issue. Organizations like the Southwood Environmental Alliance, New Jersey Environmental Justice Alliance, etc. And they created a law in 2020 that says that they are required to deny any new facilities that are trying to be built in overburdened communities like Newark or Jersey City unless they serve a compelling interest. So some findings that they put in the text of the law, if you read their law, they found that asthma, elevated blood lead levels, cardiovascular disease, developmental disorders, heritable gene mutations, those are all concentrated in our communities. So I sometimes like to refer to this as like an acknowledgement and maybe even an apology letter to communities of color and overburdened communities, because one of the last statements they have in the law is it is past time for the state to correct this historical injustice. So they've seen it, they've admitted it, and now they're trying to take steps to address the issue. So environmental justice happens on multiple levels in New Jersey, and incarceration facilities are facing this worst and first as well. And we're about to get into that.
Thank you, X, for that amazing overview of what environmental injustice looks like, and what environmental justice looks like. So how that intersects into incarceration is there's a emerging field of study called prison ecology. It's still it's fairly new and still being looked at, but it essentially focuses on the environmental harms that are caused by prisons, whether if the prison is being built on a contaminated site or near, or it becomes a source itself as environmental degradation due to poor operations or neglect. And so environmental justice and incarceration looks different compared to where you are, to compare to different facilities. So one environmental factor is proximity to toxic site. So a lot of prisons throughout the entire US are located near Superfund sites that expose those incarcerated and working into these facilities to these harmful chemicals and pollutants. And it's especially harmful, especially to a prison or an area that's prone to flooding, because all of those contaminants that's in that soil, that groundwater, it just gets pushed into these facilities' waterways and into the facility itself. Another thing is air quality. So inadequate ventilation leads to poor air quality, increasing respiratory conditions like asthma, and then also exposure to extreme heat. So many facilities throughout the entire US aren't temperature controlled, and they lack green canopy spaces. So that creates the urban heat island, which allows for the retention of heat. So let's say it's 80 degrees, and just because there's no tree covering, it just intensifies that heat, creating an increase in heat related illnesses. And on the right is a chart from the Prison Policy Initiative. They did a study on extreme heat exposure throughout the entire US, and they said that the Northeast region, in terms of heat waves, saw more mortality in their incarcerated population due to the exposure to extreme heat. And so before we get a little bit more into what incarceration and environmental injustice looks like, how how many contaminated sites do you guys think there are in the state of New Jersey? You guys can drop your answer in the chat. You guys can shout it out.
I'll take a guess, 12,000. That's 12,000 number.
Okay, okay.
Anybody else want to guess?
Yes, I'm going to say, as a nurse who worked with that, it's probably the 15, the highest.
I can't see the chat. X, do you see
Yeah.
any?
That's what
I'm
I
seeing-
said too. The highest number.
I'm
Not being a
seeing,
nurse, but being an
um,
advocate in Jersey for 30 years. Yeah.
Right, right. I mean, and hey, everything we talked about, like that doesn't happen in the air, it happens through contaminated sites. So I'm seeing 56, 10,000. And Gail, you put that 15,000 in. And Price said closer to 18,000. Good guesses.
It's very good guesses. So it's actually a total of 13,437 contaminated sites throughout the state of New Jersey.
And there could be more, right? It's also about who's testing for where contaminated sites are. So some of them we don't even know where they are because the DEA
Right.
haven't tested yet. So
Okay, another question. Roughly what fraction of New Jersey's correctional facilities do you guys believe are located either directly on a contaminated site or within a mile radius of such a site?
I'm going to say the 1 in 10.
Okay.
Oh, wait a minute. Maybe I read that wrong, but they're all on, they only put them on contaminated sites because of the cheap land. So we have 14 prisons is throughout the state.
I think 1 in 10 is appropriate.
Yeah, I'm going to agree because I work as a nurse and a volunteer with the League of Women Voters with their voting rights. So I visit the correctional facilities, and also when they come home, knowing all the unfortunate healthcare issues they have. So I'm going to say 1 in 10 also, because going to those places, it's bleh, wow, it's amazing.
Wow.
So it's actually 1 in 3 facilities throughout the state of New Jersey are located on a contaminated site or within a mile radius of a site.
I mean, definitely, Ms. Scott, I feel like if there were more facilities, that number would be way higher. But, you know, we only have a certain number of facilities here. But 1 in every 3 of them happen to be right next to a site of either water contamination or soil contamination. And soil is inhaled. So it's not just about the water quality, it's also about when folks are outside, when the staff is interacting with the outside. All of those folks are being affected.
Soil is contaminated by lead, radon, and whatever else.
Right.
You know, the contamination of the sites are also, you mentioned the water in the prison. And I just wanted to make a mention that we had the pipes changed here in Jersey City because of the lead. And they might need to have an inspection in that regard to help them, you know, change the plumbing and things like that, update it, because maybe it hasn't been done in years. And then you have leakages in the pipes and things like that, sewerage, and it can be a contamination within the building.
Yeah.
And also the trucking, the pollutants from cars and things like that, they should really be working on the genius of invention to reestablish an invention that helps with pollution. Because there's no reason to have all that type of pollution from the exhaust. But you know, the water is probably a plumbing issue, and it should also be tested for filtration and make sure that the water, like that, to analyze the water to make sure to see what contaminants might be in that water. And that's, you know, that's testing that can be done simply.
Exactly. Yeah. And honestly, it has been done. Like that's kind of what the research is showing us. They've had a lot of these facilities have had consistent violations for not changing their plumbing, for not, updating their lead service lines, etc. But nothing is really being done about it. And it's not unique to us. We have the whole toxic free prisons mapping thing is because this is happening all over the country. Like these people are being discarded, their health isn't being prioritized. In our DEP, unfortunately, they can give a facility a fine, but does that really mean that they'll change their, systems? And from what we're seeing, no. No, they've had violations going back for years and they just keep getting them and people keep getting sick. And hopefully we can explain a little bit more about how that happens and how we can address it.
Mhm. Yes. And so really great points, and kind of like what X said, it is not just New Jersey problem, it's a United States problem, the conditions, the environment in these prisons. And so kind of talking to that, those incarcerated are considered a vulnerable population because they're unable to relocate, avoid exposure to these hazardous materials, or access basic environmental protections. And so going into some of the New Jersey state specifics, in 2024, the incarcerated population consisted of 61 African Americans, 22% were white, and 17% were Hispanic, likely coming from pollution burdened communities with pre-existing health conditions. And once they're inside these facilities, around the poor air quality, the poor water quality, inhaling the contaminated soil, it's only increased. And so a significant portion of New Jersey's prisons lack full temperature control. There's 3 state prisons that are fully temperature controlled out of the 9 state facilities that we have. Those incarcerated, in an ombudsman report in 2023, they did temperature checks of the cells, and they reported cells reaching up to 94 degrees during the summer time. And so those incarcerated described these conditions as unbearable and like hell. And with New Jersey's growing climate, climate change is a thing. Concerns have been risen about warmer seasons and heavy rainfall, and how that will increase mold, mildew, and not just intensify respiratory issues such as asthma, but also create an environment for more pests and rodents. And to the right is a picture from a recent ombudsman report. They did a report for the Garden State Correctional Facility, and you can see it's a picture from the shower, and you can see the grime and the rust on the shower walls, and on the handle as well.
Yeah, and again, like this is a youth facility. You see how they're treating our children in these populations is ridiculous. And just to comment on that 94 degrees Fahrenheit, correct me if I'm wrong, Sydney, in the summer it should be 70 degrees max, right? In those facilities. Exactly. So the rates of people even getting sick, and then on top of that they have to drink contaminated water. How are you going to come out of these facilities with better life chances if they're not giving you a chance to your health in the first place?
Mhm.
Mhm.
And to add to that too, those incarcerated are only allowed to purchase 2 cases of water for the entire month. So that's about 48 water bottles. And with the summer coming and a lot of the facilities not being fully temperature controlled, it causes concern for water scarcity, especially when commissary doesn't account or allow for additional water bottles be purchased, or sometimes they don't have water on commissary for those incarcerated to order as well. And so just to highlight some of the findings in the ombudsman report, for the Garden State Correctional Facility, the temperatures range from 79 degrees to 90 degrees. And 7 out of the 9 houses reached above 86 degrees. They observed that meals were observed without drinks, even in the extreme heat. So they also saw that the beverage dispensers were filled but not delivered to the housing unit. So going back to that water scarcity, if they are only allowed to purchase 2 cases of water for the entire month and they're not getting water with their meals, and water's not being given on the commissary, there's no other source but to drink other than this contaminated water source that they have. They also observed rodents and insects, were reported by both the staff and those incarcerated. And just to say all of this, it's one facility. There's many carceral facilities throughout New Jersey, and they each have their own specific problems and issues. But there's no safeguards that exist to protect the carceral facility or the carceral population from these environmental hazards, leaving those incarcerated without protection. And to the right is another picture from the ombudsman report. And this is just showing the chippings in the shower. It's a really good report to see. They also talk about how the facility was really made for, the cells were really made for one person, but they're doubling up. So if you guys want to take a look at it, the QR code will take you directly to the report that they just put out, and definitely should give it a read.
Yeah, and Sydney, if you want to say another thing about overcrowding, that's just been an issue historically. And during COVID, that was definitely detrimental to folks' health in there. Do you want to say a little bit more about that?
Yeah, so New Jersey actually had one of the highest mortality rates against staff members at the correctional facilities and those incarcerated as well, due to the amount of COVID-19 people that were getting COVID-19. And so we actually did a webinar with Council President Waterman, and we talked about the racial disparities in New Jersey, how, like I said, I believe it was 61% makes up, 61% of African Americans make up the prison population, but they make up about 15.5% of New Jersey's population as a whole. So that says a lot about racial disparities within the system, and then also just how many people are incarcerated as of right now in the system as well. So going into one of the laws that the campaign is really focused and centered around is the Safe Drinking Water Act. So this is a federal law that was passed in 1974 to protect public health, by regulating the nation's water system. So this act oversees water quality, the suppliers, and it makes sure that everyone is meeting these standards. So this is through monitoring, sampling, and reporting. So some key aspects of this was the EPA set limits on harmful contaminants that were allowed in drinking water. So bacteria has a certain amount that is allowed in like a healthy limit in the water, chemicals and metals as well. Water systems are also required to test and report on the water quality. This includes annual consumer confidence reports that is given to those that consume the water source, as well as the public. And then it also set in enforcement. So if these standards are not upheld by water suppliers or the water system, they're subject to fines and they have to do corrective action. And so that kind of brings us into the water quality violations that New Jersey's facilities have been receiving. So overall, throughout the entire United States, between 2011 and 2021, 18 of the 408 carceral facilities nationwide were cited for over 5,000 Safe Drinking Water Act violations. So that includes monitoring and exceeding the maximum contaminant level, so exceeding the limit that is set for certain chemical, metal, or bacteria inside the water. And so a lot of carceral facilities source their own water. So what that means is that there is a well onside the property and the facility pulls water from a water source. So in New Jersey, there are 3 active public community water systems. There's the Mercer County Correctional Facility, Albert C. Wagner, which serves the Garden State Correctional Facility, and then Bayside State Prison as well. And so a lot of these well, not a lot, all of these facilities have received violations for exceeding maximum contaminant levels for PFAS, manganese, and other harmful contaminants such as E. coli and known carcinogens. They've also failed to sample the water or monitor or report to the DEP when they've gotten an alert that a contaminant was exceeding or they got a trigger warning. And then also they haven't been submitting their required consumer confidence reports to the public. So on the right-hand side, you'll see a sample of a consumer confidence report. And this basically tells those that are consuming this water, where the water is coming from, what contaminants were found in it, the levels that they were found in it, if there were any harmful contaminants that they were consuming. And the goal of consumer confidence reports is really to help those consuming this water source understand the quality of their water, what's in their water, and any potential risks that are associated with drinking this water. But these facilities are not producing this report whatsoever, so no one knows what's going on in the water. These reports help residents because a lot of people aren't going to go onto the NJ Drinking Water Watch and see, oh, well, this contaminant was tested and it was found and it was over the limit. So these reports lay out what is really in the water. And so without that, no one knows what they're consuming. And so the long-term exposure and health risks. So long-term exposure to environmental contaminants pose significant health risks. Like we talked about a little bit earlier, a lot of those coming into the carceral space and getting incarcerated are from these overburdened communities where they have pre-existing health conditions, such as asthma or weakened immune systems. And getting into these facilities and they're staying for long periods of time, it only increases those health risks. So when they come home, they're not as healthy as they would have if the system had safeguards to protect them. And so on the right is just a chart. It takes into account all of the state prisons and then also at the county level as well. We gauged it on the mandatory minimum sentence, which is basically means that the incarcerated person has to serve an entire, like their minimum sentence before they are eligible for parole. So about 62.6% of the incarcerated population with a mandatory minimum sentence will experience long-term exposure to these environmental hazards. So the proximity to toxic sites, poor air quality, poor water quality, poor ventilation. So we gauged it on if you had a mandatory minimum of 5 years or above. So even if you had 5 years you're incarcerated for, you're more likely to come home with significantly more health risks due to being incarcerated. The Prison Policy Initiative also talked about how 1 year of incarceration takes off 2 years of your lifespan. And just kind of the stories that we've been hearing through the campaign, it just kind of sheds a little bit more light on the health risks of being incarceration and why it's important to have these safeguards in place. And so one contaminant that was tested at the Garden State Correctional Facility was manganese, which is considered a secondary contaminant. So really, what you'll see is it'll cause water discoloration, staining, and the water will taste metallic. And so manganese is an essential nutrient for human beings. However, long-term exposure over the amount that is allowed has been linked to neurological problems, including memory loss, difficulty with movement, and changes in behavior. And so when we talk about like incarceration too, so if you see more people going to lockup and everything like that, you have to also say, well, I understand that, but also they're consuming this water that is contributing to their brain function and their movement. And so that is also another kind of thing that we're bringing to light with our campaign as well.
Right. Yeah, and Sydney, before we talk about our campaign and what we are
Mhm.
doing with the information, we just want to open it up to questions or comments so far. Any reflections y'all have on the information? And we can start by taking hands and seeing what's in the chat. I have the chat open.
Okay, could you talk up louder, please?
Can you hear us?
I-
Is it better?
Yeah, you know what? I can hear you more than I can hear her.
Okay,
So, but
is
if
that
you,
better?
yeah, if you talk real loud, that'd be good because we want to,
Okay, I got
it's hard to
you.
hear
Awesome.
what you're saying.
Okay. Yeah, this is some heavy stuff. And like we said, it's all systematic. Like these things don't happen on accident. People don't get deprived of clean water on accident. This is about a group of vulnerable people consistently being exposed and not heard and not having their opinions and perspectives valued, even on the point of manganese. We actually had one of our first webinars where a previously incarcerated person from the Edna Mahan facility, she talked about a manganese outbreak where they were giving out water quality notices where they couldn't turn on the water, and the water that they could use, they had to boil it. And they can't boil it, right? So they were microwaving the water, which does nothing essentially. So there really isn't any protections when outbreaks happen, regardless of if they're consistently getting these violations or not. When outbreaks happen, they still aren't protected.
Yeah. And Sydney, I didn't mean to call you out like that, but I
Oh,
just wanted you to
it's
talk a little louder. And the thing of it is money. And
Yeah.
maybe Councilman Gilmore can help facilitate a method to get money, a grant from the government or something like that. There has to be a person that represents the population that is in under those conditions. And if you don't have money, you can't have you can't have the plumbers, you can't change the pipes, the water testing is limited, so you have to have that. So just for the water part of it, and then also the health of the people, their skin, and make sure that they're because there was something about they were getting burned when they were taking a shower. Some people might have things like psoriasis or eczema, or so. I'm just saying that, and the diet. What foods are they eating also? So all of that goes into play with their mental capacity. And why are they in prison? Maybe something can be done to help prevent them from being incarcerated in the first place. That's one of the initiates that you have to we have to figure out why is there such a high population of Black people that are incarcerated? What's happening? That we're not, many people are not being able to be prevented from going there. What are the options that we can help build? And maybe the councilman and other people can figure that out for the next meeting, to bring some of those things in, is prevention on how not to go there in the first place, because some of these people keep going there, and we don't want that to happen. And some people, they're able to get out of it and not keep going and doing that. So, and what happens to them when they come out? How are they being also helped? But the prevention is one of the most uh inspirational necessities. How can that happen? How can they be prevented from going there? And the money that it takes to have some of these ideas. They're worthy ideas, but where's the money?
Yeah, that's the biggest question. They're saying there is none. You know, they don't have a budget for water quality maintenance, and that's one of the things that Sydney actually found in the research first, right?
Yeah, so the DOC does not have a operations or maintenance budget. So they don't have a budget in place to maintain, fix, repair the water systems or anything like that. Um, these facilities in like New Jersey, they're fairly old. So we're talking $1 million kind of budget plan to fix, change, anything like that, rebuild. So that's why for our campaign, our demand is just right now an immediate source, secondary source of water, while they are assessing what needs to be fixed, replaced, or changed, or the best way to make sure that this is not a recurring thing. Um, and so, kind of like backtracking a little bit, prisons often fall out of this scope for environmental protection. So, when we talk about, oh, well, there should be an operations maintenance budget, there should be this, there should be that, there's no law that says, hey, those incarcerated and those working in these facilities are a protected population. They need this, and that, and there's no oversight over that. And so this campaign is really birthed out of research that I'm doing with my advisor at Kean University, Dr. Galia Shukri. And I want to say about a year ago, I reached out to you. I was doing research in my undergrad studies about the extreme heat exposure in New Jersey's prisons and those health effects. And I was starting to get a little bit more into the water quality and the water results. And I reached out to X and I was like, this is a huge problem and I want to do something about it. And that kind of birthed our campaign. So the goal with my research is a participatory based action research. So we're utilizing the stories of those formerly incarcerated, those working in the facilities and recently that retired from the facilities to really shape the bulk of the data collection and the research, as well as collaborating on much needed policy reform and changes. And so our campaign goal is really to push for that inclusion of prisons in both the federal and state environmental justice frameworks. They're not in that framework right now, and that's why the violations that they're getting is semi-okay because there's no one oversighting or over saying, hey, like you didn't test this and this the water sample. They're just getting fines and a slap on the wrist, and that's really it. And then we're also advocating for a greater transparency and accountability in the operation of the correctional facilities. So these consumer confidence reports that says, hey, this is where we get our water from. This is what was tested in the water. That should be publicized and that should be given to those working and incarcerated in these facilities so they know what they're consuming at the end of the day. So like I said, our demand is right now an immediate secondary source of water. Water bottles are not on commissary. It comes and it goes. And then 2 cases a month is not enough, especially with New Jersey's growing climate. So we're having conversations with the Ombudsman office and with officials from the government's office and the DOC as well on how we can get an immediate secondary source of water into the facilities. We're also asking for an assessment of the prison water systems. Like the Albert C. Wagner, they put out a scope work that says that they have 13 rotors that filters out bacteria, and there's only one that's working right now. So an assessment like that needs to be done for all facilities to see, is it a plumbing issue? Is it a lead pipe issue? Or is it, there's a new rotor that needs to be purchased or and installed, or is it the well itself? So we're asking for assessments of all water systems. We're asking for a dedicated operations and maintenance budget. Like I said, there is none in place right now. So the maintenance is kind of, oh, the roof fell. This is a priority. So having a budget in place and a procedure where, hey, every week we go and we check this. Every week we go and do this, or we repair this to upkeep these operations. And then we're also advocating for free annual health checkups and cancer screenings. A lot of the contaminants that are not being monitored and reported are known carcinogens. So increasing the risk for those incarcerated and working in these facilities to get cancer. So by advocating for free checkups and screenings, we hope that they come home, or those that are working are less prone to getting cancer or getting sick due to these hazardous conditions and environments that they're in every single day.
Well, Sydney, you know, there are people that they do research, and they for other things, like when COVID was happening, and how to keep the vaccines cold, so that, you know, in refrigeration, they didn't have that in certain countries, and so they did an invention to help reserve and preserve the vaccine. What needs to happen is you have science majors, the like I think Dickinson is a science major at high school. You have colleges, but these people that came up with it, they were in high school, and it was a group of them, and they were led by their professor to help them, and they won an award from it, from the government, and they were able to get money for themselves and also to fund the project. So if you have people that are you know, are passionate and talented, then they would be able to come up with ideas and creativity. And if there's a grant in place that inspires them, like to they would win a prize, then they might come together and help organize something. But you might need even the lawyers, that there were free lawyers at one of the meetings that I attended, and perhaps they could get involved in fighting for the rights of some of the prisons. It takes a collective effort, and most of the people that are concerned about it don't have the money. So because, you know, they understand the problem, and maybe it's a loved one of them that this has happened to, but maybe they can't afford it financially. So people that and maybe they can, you know, it's all different people are
It needs,
inspired in different ways.
yeah,
But
it's just as a
yeah.
social justice issue, it needs to be everyone. You know, we're trying to make this coalitional. So we actually have some environmental lawyers here who want to help us out in finding the data and holding people accountable for what they're doing for the water. But we also have folks here that have already done this work in other states. Dr. Jackie Hahn is in the audience, and feel free to comment if you want, but I'm not going to put you on the spot, Dr. Hahn. But yeah, in other states, they've actually used that data where they found from their environments to make things like the Environmental Health in Prisons Act that just got introduced last September by a senator out of Massachusetts, I believe. And a lot of their data came from community data that they started collecting from returning citizens groups, people on the inside already. So really uplifting the voices and pairing the voices with the science and the reports, that makes the strongest audience, and strongest argument for us. So you're absolutely right.
Yeah, and I
Absolutely.
think to your point, I think that's my favorite part of the campaign, and then also the research is sitting down with people, hearing stories, hearing like, yeah, like my water, it's not good, it's not safe to drink, and I don't know, it's just something about hearing it and seeing people overcoming that and coming home and doing like amazing work. But also, I feel like it humanizes those incarcerated. I feel like there's this perception, oh, you're incarcerated, you're a bad person. But that's not the case. You know, they're still people at the end of the day, and they deserve clean water. So hearing the stories, I feel like is one of my favorite parts of the campaign. And even like we've heard from grandmas, we've heard from nurses that are currently at the facility, and then even moms as well. Like one grandma, she stated that she tries to buy her grandson as much water bottle as she possibly can, but he still feels sick and throws up. One mom says that she's been dealing with water. Her son's been dealing with water issues since he's been there, and that they've been forced at times to use the bathroom and porta potties outside due to water quality problems or plumbing issues. We've also heard nurses who have said that, like, I am scared for my health as a nurse working in these facilities and for those incarcerated as well. And so I feel like storytelling is an amazing aspect, and it's also a crucial aspect of our campaign, because it also allows those impacted to be a part of this meaningful work, but also it provides a space for healing. You know, incarceration is not an easy thing, especially if you're there for a long period of time, or even if you're there for a few weeks. You know, you're seeing things, you're hearing things, you're experiencing things. And so we've seen a lot of people, when we've had these conversations, it provided a space of healing and a safe space for them to share their experience and also kind of be a part of this work that we're doing to correct the injustices within New Jersey state prisons. And so we actually have a story from our October webinar.
And I just wanted to take a pause
Yeah.
there. Sorry, Cindy. I see Dr. Han on the screen, so I'm not too sure if you want to say a couple words.
I just want to say 100% agree with everything you both are saying. It's the data are not going to get us to the solutions alone, because we need to be hearing from people that are most impacted by this problem. That's, that's everything that you're saying. And I just want to say thank you so much for the work you both have been doing. This is really, really powerful stuff, and I'm definitely here to support it. And I think so many people in this room are. So thank you.
Thank
Thank
you.
you.
Okay, with that being said, we can get into, like Sydney said, the personal stories that we've heard, some of them so far.
So one that we are going to share is from Ronald Long. We did a webinar back in October. It was a panel discussion, and he shared his story about being incarcerated and also his experience with the water quality.
Sydney, is it playing?
Yeah, can you guys hear it or no?
No, I
No.
can't hear it.
You might have to change your microphone settings.
Yeah, yeah. Hmm. You might have to unshare and then share again, and then when you share, click the button that says share audio. But yeah, we've heard a lot of testimony. Actually, we're really trying to use this as a platform as collaborators to get those who are most impacted, their stories heard. Because there are folks who have experienced this for years without even having a place, to tell these stories. So we're just grateful for those who have already agreed, those who want to collaborate with us in the future, because stories is how these things get light shine on them. Mm-hmm.
Thank you.
I moved on to Rahway,
You guys hear it?
Southwoods, Northern State, and back to Southwoods, back to Northern State. And the water, I always had people purchase water for me because I was one of those guys that was limited to $15 a month due to them taking all of my money for fines and all that stuff. So, did you get the link? The water was terrible. The water was terrible then. And then, I learned about a 2021 investigation where Legionnaire's disease had actually hit Northern State. So it was there when I was there. I left there in 2019. And at least one person, maybe two people passed away, but they didn't want to make a link between the water, the Legionnaire's disease, and the COVID. So everybody just got brushed aside as being a victim of COVID. But the water there was so terrible that People were getting sick before that, before COVID even came, before I left.
So that's just one of the many stories that we've heard about the water quality. We had another panelist who talked about, like I said a little bit earlier today, that they would get boil notices and they wouldn't be able to do anything about it. So they would have to microwave the water. Or fortunately, she was a kitchen worker, so she was able to boil the water and she would freeze it for some of the people that were incarcerated with her. And she would distribute it and hand it out because she knows that water was scarce and it's not safe or clean to drink, and there was no other way they could boil the water. We did want to open the chat up and open it up, the room up as well, if anyone else was open or was willing to share any personal experiences they've had with the water quality, anything that they've seen while working, incarcerated, or anything that you've heard from your loved ones.
Well, I'll just share just a little bit that I know from just many, many years ago, when my husband was incarcerated. This is when they could wear their own clothes, and every maybe 3 to 4 months, I had to buy him new white t-shirts because his shirts not only turned a whole different color than the white, but they also got very, very thin. And so it was something that to me was eating the cotton, and definitely the water was changing the color of the clothes. And so I noticed that 30 years ago. So if they're not keeping up with the testing and filterizations, I almost bet if we could get a research to go out in the community and test people from some of these diseases, they will all come back to this prison, the contamination in the environment that they lived in and been exposed to for decades.
Mm-hmm. Yep.
It goes very far back.
And thank you for sharing.
Yeah.
Does anybody else want to share before we move on? So that brings us into the campaign and what we've done so far. So we, like I said, we're calling this our Jersey City series because the goal is not just to stop at Jersey City, it's to really get this put into different municipalities throughout the state of New Jersey and then go after a state bill that has safeguards and protections for those incarcerated and working in these facilities. So the first part of our Jersey City series, we partnered with Council President Waterman's office, and we hosted a What These Walls Won't Hold screening. It was a film directed and produced by a recently incarcerated, a formerly incarcerated person in the state of California. He talked about what COVID looked like while he was incarcerated, the mortality rates that California had, and what he's doing while he's home now, and just kind of advocating for those incarcerated and their rights. So we had that film screening. We talked about the racial disparities in mass incarceration in the setting of New Jersey, as well as New Jersey's COVID mortality rates. And then we also talked into how that intersects mass incarceration with environmental justice. We also were recently featured in NJ.com. So they came out with an article that discussed about the campaign, and it raised more awareness to the unsafe water conditions in these carceral facilities. And it also shared the stories of those impacted by the poor water quality and the poor environmental conditions in these facilities as a whole. We've also been engaging with key stakeholders. So we've held conversations with organizations like NJ Lead Free, ACLU, Returning Citizen Support Group, and then also the Toxic Free Prisons organization, which we'll dive a little bit into more on the next slide.
Yeah, and
And also the governor's office.
Yes, for sure. In the NJ.com article, well, we just found out that it was reposted in the Star Ledger, if y'all want to take a look at that. And we also thought it was really powerful as a platform for the person you just heard from, Ronald Long, to tell his story about his experience in Trenton State Prison. So it's just an example of how these points of research can empower people to start talking about that and talking about their experiences for change. So very proud of us, very proud of Sydney and all she's done to bring this issue to light, because we are definitely trying to get it moving slowly but surely. And I see Nicole has her hand up. Nicole, did you want to speak?
Just had a question. Thank you both for, or all of you, for sharing this information. I'm wondering about sort of legal action that could be taken. I understand you're talking about sort of like the bill sort of coming at it legislatively, but this is clearly a violation of your human rights, very clearly. I mean, who wants to come argue it with me, right? So what kind of, have there been cases that have been brought? Have they been brought and knocked down? Like, what's the argument that's being brought? Because it seems like the ACLU or some other org should be able to bring to sue on behalf of these currently and formerly incarcerated people. Like, they're for decades, obviously. So what's the status of that, if there is?
So Gail, was that Gail?
I'm gonna shut up and let you do it,
No,
but
did you want
I'll
to you
piggyback
could
on.
share?
I was like, I can just jump in there. Yes, I love that she brought that. It's an amazing question, and yes, it is a violation of their constitutional rights, their human rights. Yes, 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 and we are taking I guess you could say testimonies now for some attorneys that are interested in working with us. And if you are an attorney, please leave your name in the Dropbox so you could be a part of that with us, because we definitely are looking into that as well. That is being looked at right now. Yeah. We're taking
And
names for the complaints for the plaintiffs. Yeah.
And then to answer the second portion of your question, there have been some lawsuits. So Mercer County is one of the problem public water systems. For the past 3 years, they've exceeded the maximum contaminant level for PFAS. So there have been some lawsuits. There have been some that won. There have been some that were knocked down. But kind of like what Gail said, it's one of the areas that we are looking to pursue, just because it is a violation of their human right. It's a federal regulated system, and they're not doing anything about it. And their response is, oh, we're 100% compliant. We've had the water tested, but the data is showing that it's not, and the testimonies are showing that it's not. So it is an area that we are looking to pursue.
I mean, just a simple fact that they have to buy water because the water that's provided in the system isn't potable, and then they're limited to the amount of water that they can purchase. Stop. There's
Right.
Yeah.
Right. Absurdity.
Much violation.
Yes. And that's what, like, the conversations that we're having now, like we've been talking to Terry, the ombudsman. We've been having conversations with the governor's office. We've been having conversations with people at the DOC, saying, hey, like, you guys are not in compliance. The NJDEP reports show that you're not in compliance. And we've been having conversations with the NJDEP as well. And I just received an email, I want to say last week, from Terry, stating that the NJDEP and the DOC are having conversations about getting consumer confidence reports written up and published. But that's just one small problem of the whole bigger problem that this has been going on for years. And it just keeps, it's like an evolving cycle. It just keeps getting worse. It just keeps getting worse. And it's affecting those that are working and living in these facilities as well.
So I just want to say, you have people that are actually already in place to help. You have the lawyers that they already have a grant that provides them money to help people and that need representation, need to go to court, need to protest, and you also there are doctors that might be willing to help in that regard, like for the health problems that are going on. And also you can have the people that are already going to visit to the prison, and that they're might have people that are in there that they care about, and that is a whole nother group that are like they're actively there, that's they're going there and they know that this is a problem. They hear the complaints that are current, and so those are the people that would be able to be they would be able to be the almost like the in between, like between the person in the prison and also the legal and health process. They would be able to tell what is happening because they're going there and they're talking to them. That's like almost like you're interviewing a person that's there, and you can report back to the people that are on the other side, and they're concerned and they want to help. So it does become like a bridge of help. And sometimes you have it right there, and you're not you don't realize sometimes you're looking for something, and there it is. And the other thing is, like, when you have something happen to a person and you're concerned, okay, this happened to them, and then not just want to say we have to also look at prevention on how not to get people there. And the other thing was, don't forget about like a scholarship or something like that, where people could come up with ideas that is valuable. You'd be surprised what people can come up with if they're working in a group and saying, okay, you can win this prize, you can get this award, and what they would be able to come up with. So your problems are there, but the solution, what you're looking for, is not that far. It's just you have to think about what you have available.
Thank you.
Gail-
Thank you.
Gail, you wanted to say something?
No.
Okay. Okay. Well, definitely
So,
insightful information.
yes, thank you for that feedback. And so one of the organizations that we've been talking to is the Toxic Free Prisons organization. They've done a lot of advocacy across, they're based in Texas, but across the US in terms of the environmental hazards that carceral facilities pose. And they just came out with a new mapping tool, which is really cool, that we wanted to show. It's part of a research project by an MIT grad who's in her doctoral studies. And what they did was they combined a mapping tool and storytelling tool as well. So what you'll do is you'll go to Insights, and then you can click on whichever state you wanted to look at. Their information on New Jersey is very limited. They don't have a lot of information or data for New Jersey. So that's one thing that we're collaborating on them with, is getting that data uploaded into their system. Hopefully some of the storytelling and the stories that we've been hearing will be able to be featured on this platform as well. But for this, we're just going to go to California because that's where they have more of the data. You can click state, you can click jurisdiction if you wanted to look at federal prison, if you want to look at a state facility or a multi-facility. You can filter it also by security level, so maximum, medium, minimum. And then the facilities you'll have all the states on the left. I'm sorry, all the facilities on the left. So we'll go to California Correctional Center, and it'll take you right to the prison itself. It'll give you like a quick overview. It'll tell you the status, so if the facility's currently open or if it's closed, their estimated population, the capacity that they have. So you can see the capacity for this facility is 3,883 people. And then as of 2024, they had 4,336 people. So exceeding their capacity. And then if there's any data on it, it'll tell you the building age, address information, everything like that. And the bottom portion is really the environmental risks and the hazards. So it tells you the mean particle matter for 2.5, which is air polluted particle matters. It'll tell you the maximum air temp if the prison is in an area that is prone to flooding or if it's not. The risk of wildfires. New Jersey has had their fair share of wildfires recently, and those fumes and that smoke affects those incarcerated, especially if they don't have tools to protect themselves. So this one facility is at risk and is prone to wildfires and the effects of any wildfires in the area. And then it also breaks down charts, highest impact on facilities.
Yeah, the statistics also, if you go back, Sydney, that facility is located next to 16, almost 17 toxic facilities.
Mhm.
So that just shows you a little bit about what they might be experiencing environmentally, and that's not too far off from New Jersey. Like I will say, in the Ironbound, in the most heavily populated place with the pollution, is right across the street from Delaney Hall, a immigration detention center that just opened up. There have been protests there. If y'all are from Jersey, if y'all know anything about it, our mayor was actually arrested there for protesting against the facility. And I'll say about the environmental conditions, it stunk. It stunk. It smelled like people should not live next to it. And that's because right across the street, they actually have a fragrance facility that burns animal carcasses. That's how fragrance is made. So people were going there to protest. We had to wear masks, and folks are inhaling that in Delaney constantly. And Delaney is also next to Essex County Correctional Facility. So that's just an example of like what living next to a toxic site could look like.
Thank you for adding that. And then it also goes into more statistics, and it'll also tell you the highest temperature that the facility received. So the highest was 116 degrees. And then it'll also tell you if there's presence of air conditioning in the facility, and there's not. So imagine being in a cell and the cell reaching 116 degrees, a little bit more, and not having air conditioning and having to rely on a fan.
Right.
So this is one of the sources that we use, and one of the organizations that we're looking to continue our collaboration with, just because they have some really great data, and the stories that if you go on and you hear, it's crazy that this is a thing, and that it continues to be a thing, and not just in one place, but you'll see it everywhere.
And also traumatizing, right? Like
Yes.
these are not light stories at all. So I wanted to make a point about ethical storytelling. The reason why we really want to collaborate with them is that they are paying folks to tell their stories, compensating community members for their voice, their power, and all this. And we want to make sure that that happens in New Jersey as well. None of this should be taken lightly, and our communities deserve appreciation for all the data points we're using to advocate for change. So this is a really powerful example of how we do that in the most in the most ethical way. So we appreciate what Toxic Free Prisons are doing.
Yeah.
Okay, now my thought came back to me. It came back. I couldn't pull it up, but are we in our state, when you look at the other states, do they test are they just as bad, like with their testing in other facilities as we are? Or like, have you find out like what's the ratio? Are we like in the top 10 of the worst states, or I'm wondering.
So we haven't looked at the ratio to see who's worse, who's better. But the issue persists throughout. Like Massachusetts, they put a bill in place just because of that. And I know I don't want to call her out again, but I know Dr. Yan, she did some work up in Massachusetts on a similar campaign targeted at the water quality. I know it's called Deeper Than Water. It wasn't just about water, it was the overall environmental risks and the hazards. But they also talked about the poor water quality there as well.
It's also just very hard to keep track of this stuff.
Yeah.
If we're not watching it, then it's just slipping through the cracks, like that's what I like to say as an organizer. We are the folks that can save us because who else is looking at this but loved ones, allies, etc. So that's why we're trying to collaborate across states to put all our stories together and to show them that there is a trend across them. So yeah, that's a really important point, Gail.
You need to have also, just going into this a little further, you need to have documentaries that help to present the problem. You can upload it on YouTube. People can view it and they would have more of an understanding, because what happens is if we don't talk about the problems that are affecting us in our community, then we won't have a voice. And if you don't have a voice, you don't have a map, and you don't have generational wealth or of knowledge or monetarily, financially, it's just not there.
Exactly.
So you
Part of
gotta have all of those things happening also.
part of the reason that it's gotten so bad is because people that are in these communities and in these prisons are thrown away as looked at as discarded people in the first place. And so we really have to start with ending the structural violence that's been allowed to be put in place by the government. A lot of these issues really, like I said, they don't build prisons on, you know, great land. They look at the cheapest land, which is usually the contaminated land, to build the prisons. That's what they bid for. And so, and we know that they fill the prisons in the communities where the tax dollars aren't as much as other tax dollars, where the public schools aren't funded for that particular community. It's all systemic racism. And until we start identifying that problem right there, that's why these type things aren't funded. These type things aren't looked at, because these are throwaway people. They take the immigrants and they build the ICE unit in a contaminated part of, like, you throw away people to these folks. And so,
And then they don't show you, they don't tell you how important education is on the grades. People think, oh, kindergarten, that's not that important, or these are the grades, and they are actually very important. And the other thing is that the prisoners, it's very hard for them to be able to speak for themselves, based on what's happening and where they are. So the people that live in those surrounding areas, I mean, it's not, where are they? Those are people that are being affected also by these contaminants, and those are the people that you have to really reach out to, because they're the ones that can actually be very vocal. They can go and they can have protests and complaints. They can go to the doctor and they can say, this is the problem I'm having, this is my ailment, I feel like I want to get tested for cancer, I want to, all of these different things.
yeah, but
That
if they
is
don't have,
building your case.
you,
Yeah,
but
and
you
with
think
that,
that people have health care. That's another part of the systemic problem, and under the structural violence. People don't go to the doctors because they don't have no health care. So
right.
you can't go to the doctors. These things
Yeah.
aren't so accessible for this population of people. And that's why we're in this predicament that we are. Our New Jersey Department of Corrections budget is the second biggest budget that the governor has to deal with. And it should be money allocated in that budget to be able to do this maintenance in these facilities where they house our family members. And as we continue to do community outreach in this campaign, we will hear from the people in the communities. They will come, because I don't think they even realize that their sickness came from them being incarcerated for 25 years,
Yeah,
drinking that water, smelling that water, taking
exactly.
showers in that water, because you're inhaling it. Even if you're not drinking it, you still have to take a bath in it.
Mhm.
So we have a
So
few more slides to get through. Hopefully, we can circle back to some of those comments, but we just wanted to leave y'all with a couple resources and really exciting development before we get off. Sydney, did you want to go to the next?
Yes, I did want to say too, if you guys did have to go at 6, we are, this Zoom is being recorded, so we will make sure that everybody gets a recording as well. But just being conscious of everyone's time, and we'll open it up, like X said, again at the end for some more questions, storytelling and everything like that.
I just
So
want to, can I just say one thing, because I want to help understand, clarify that I'm talking about the people that live in the areas. I know what you're saying, that but what I'm saying is that those that can't fight because of their positioning, those that live in the area, they can fight. And they do have free resources, doctors funded. They even have a place right in at MLK where they're doing free testing. Now, that was for STDs. I don't know if it's for other things also, but that could be asked too, because there was a person there at the last meeting, the other meeting, not the last meeting, that said they had the free testing. Now, if they have it for that, they probably have it for other things. Sometimes it has to do with, you got to dig a little further. You got to do the research. And let me tell you, when you're in pain and things are happening in your life, it's hard to do that research. That's why you have to go to the people that may be in those positions that would be able and go and attend the meetings, because sometimes they ask, is this happening to you? Can we help in this regard? And so, I mean, those are some of the things. I'm just saying, sometimes you have to unite, and you have to fight for peace. Your protests are not going without being heard if you're saying it to the right person, if you're saying it to the person that is in a position to help you. So that's all I want to help you understand. You got to get the people that live in that area, not just the people that are in prison, because you got to, who's it else is it happening to, that they can also come forward and say, this is happening. I own you know what I mean? I live there, and you're not in prison. What can you do? And then that will start, the area is being now included. Oh, wow, wait a moment. There's other people that live there, and they're fighting it, and they're talking about it too. So why is their health being, why are they not healthy? Why are they having these conditions? Because they're breathing in the same air. So you got to start around sometimes like that, and then go into your position. It's like a game of chess at times. So that's what I'm saying to you.
Thank
It's a
you.
strategy.
Dita, for the sake of time, I'm sorry, I just want to make sure X has time to finish their presentation. And then we'll wait for the very end for final comments.
I wanted to ask, first of all, the Congresswoman was also arrested, LaMonica MacIver. She was too, ridiculous. But also I wanted to ask you, Trenton State must have the worst lead levels in the world, because they were built, that prison was built between 1833 and 1836, and it's still operating. So the levels must be off the highest data anybody ever collected in the world.
And that's actually a place where we're trying to collect data from. Like I said,
Oh.
Ronald Long was, so we're so grateful to him to have shared his stories about Trenton State, and we're really trying to get more. So
Yeah.
yes, let's talk about what's next. How can we help folks? Sydney, did you want to take that over?
Yes. So, to Ms. Green's point, the goal is to build a broader base of support and amplifying the voices of those impacted. So that's why we're thankful for Councilman Gilmore for giving us this platform to share more with the residents of Jersey City, to continue our outreach and our education on the issue. We're also, what's next is collaborating with Jersey City legislators to pass local ordinances such as our Bill of Rights for incarcerated people, to put in safeguards for their environmental and health rights. Also, like I stated earlier, I'm a graduate research assistant at Kane. So we just submitted the internal review board the research project, and it's currently in review. So we'll be able to start conducting semi-structured interviews and being able to compensate those who are willing to share their stories of being incarcerated, working in the facilities, or having a loved one that's incarcerated. And then some of the upcoming events that we have, we're looking to host a town hall to share more about the Bill of Rights, and also getting some more support so we can start passing that local ordinance. We're looking to host another webinar event that will talk about the heat exposure and the health risks of those that are incarcerated and working in the facilities. And then in August, we're calling it our 1-year anniversary with the campaign, we're looking to host a rally at the State House, advocating for a Bill of Rights and uplifting those voices of those impacted. So we will definitely be sharing the flyers, the information with everyone, as well as we continue this process of pushing for the rights of those incarcerated.
And with that being said, the last thing we want to leave folks with is what we've been working on in New Jersey. We have a declaration on the rights of incarcerated people, or Bill of Rights for incarcerated people, that we formulated after we discussed with Congresswoman Presley, who has introduced the Environmental Health in Prisons Act, and we want to adopt it to a New Jersey level. We recognize that this is happening all over the country, but seeing our current federal administration, a lot of this stuff is just hopes and dreams for the federal level, but it's really about states taking initiative and passing something and proving to other states that this can be implemented. So we really need folks to comment on our Bill of Rights. We adopted some data from from Congresswoman Presley, and then we included some of the data that we found in New Jersey, and we just want to make the most elegant, strongest argument as to how and why we should fix this issue. So we have a rolling comment period. We will be holding stakeholder meetings very soon over the summer. And yeah, this is the call to action we want to leave y'all with. Please read through it if you can. Even short comments, we have a little submission form as well. Yeah, this is one of the paths we have to getting change. We need the stories, the grassroots organizing, but we also need comments from you all about how this should be structured in New Jersey. So with that being said, I put those links. I put the link to the Bill of Rights. I put the link to the comment period flyer there. With that being said, thank y'all for being in community with us. Thank you for listening to the information. We hope that you share it with your friends, share it with your family members, anybody who you think would be interested. And I put some of these links already in the chat. Our campaign page is up and running. The petition is still ongoing. We have over 250 signatures so far, and the Declaration of Rights. Let's get it going, people. The more people we have to voice their opinions, the better. And with that, I have nothing left. And thank you. I recognize we're a little bit over time, so we can take the next 2 minutes for comments if you would like. But at 6:10, we are going to end the recording and close up the session.
This is Erica with Councilman Gilmore's office. Thank you so much. He did have to go into another event. But I want to thank you ladies for definitely doing the work, doing all this research, and putting it in a way that is easily digestible for us common folk. You know, a lot of times, sometimes this research can be hard to digest. But you're doing great work. This is serious work, and we all need great advocates. So continue the great work. Keep up the great job, and we're going to continue to share these links on our social media pages and our newsletter. And this video will be available on YouTube and Facebook as well.
Awesome. Thank you for the platform. Is this Erica or Lanisha?
This is Erica.
Hey, Erica, thank y'all. Thank you in your office for, collaborating with us, because legislators, local legislators, this is the platform we need to bring it to. We want to do it in Newark, any place y'all live as well. So tell your council people, tell, your elected officials that this is an issue you want people to look into. It's offices like Councilman Gilmore's that really set the initiative and set the tone for how seriously this should be taken. So thank you again, Erica, for coordinating this with us. And you can thank Councilman Gilmore again for me.
Absolutely. Thank you,
And-
ladies. And thank you
thank
all
you.
for joining.
Thank you both. Thank you very much. And I'd like to connect with you because I work with incarcerated people and every week, and now I'm helping do a mental health, since that was my specialty, with the reentry program in Carteret. And it is so needed. Whatever services can be provided, it is greatly needed. And I wanted to ask too, what about paint? Even though that we're not supposed to use lead paint since 1978, but those walls there, I'm sure they're still covered. And I was a certified lead examiner when I was a school nurse, and testing the children who ate the lead paint, and their levels were very high, and in Newark and Jersey City. So I'm just wondering, did anybody ever test the walls of the correctional facilities for lead paint too? Because when they chip, that can cause a problem.
That's actually a really good point. I haven't seen anything with the lead paint. I'm not sure if you have. I know, like, with the lead pipes and their service connectors, them not replacing that, I've seen a lot of that. And I know that's a huge issue lately in New Jersey, like the lead piping and everything, but I haven't seen anything about the paint. But I would assume too that it causes, it has its environmental, like, and its health risks.
Oh yeah.
Yeah.
Mhm.
Yeah,
Yeah.
it does.
Federal
It does.
funding for the lead
Yeah.
paint inspection. So if you have a person that is in prison and you are concerned about that, that is something that could be specified and called to their attention.
Yeah, Vita,
Yeah.
definitely connect with us after, and Miss Scott. Like, your information is super important. Unfortunately, I
I
do
will.
have to go to another meeting. I'm a little bit late, but it was so
Okay,
nice
good.
to be in
And
community with
thank
you
you.
all.
Thank you
Yeah,
very, very much, because
Good
this is a
job.
problem we know of, but how much is being done to help them, because that's a very vulnerable population and highly stigmatized.